Hi, Mike Gibson, Jim Januzzi, coming to you live from ACC 2024, and we are talking about diabetic cardiomyopathy and its treatment. Jim, this is a new drug in the class. Talk to us about how it works, what you studied, and what you found.
Yeah, sure thing, Mike. Thanks. And, obviously there's a lot of buzz about this because it's an opportunity for us to prevent onset of heart failure. I mean, we talk a lot about treating heart failure. We talk a lot about prevention of heart failure, but this is one of the first trials that has really tried to specifically look at preventing transition from stage B to stage C heart failure. So from pre-heart failure to symptomatic heart failure. The idea is based on the observation that the polyol pathway, which is one of the pathways that is activated in particularly in the setting of hyperglycemia in diabetes, this pathway is associated with tissue damage owing to the production of sorbitol and fructose intracellularly. Now, the good news is that there's a step in the polyol pathway that has a rate limiting factor, which is the activity of aldose reductase.
Hmm.
And it turns out that aldose reductase inhibitors have been around for a long time. But although this drug is not first in class, it is the most potent and clearly the safest candidate in the aldose reductase inhibitor class of drugs because other drugs in the class have been associated with off-target effects, which this drug, AT001, does not. So we hypothesized that blockade of the polyol pathway using this aldose reductase inhibitor would slow down the progression of heart muscle disease among individuals with diabetic cardiomyopathy and in turn improve their exercise capacity. So we looked at the primary endpoint of this study was that we looked at the peak oxygen consumption, the peak VO2 among individuals who have diabetic cardiomyopathy.
And what did you find?
Yeah, great question. So, first and most important thing is it's remarkable how impaired these individuals were. So, at baseline, the peak VO2 of the group in the group as a whole was 15.7. So, to translate, a peak VO2 of 15 or 16 is what we see in people with full blown heart failure, right?
Wow.
So, and
Hmm.
these people do not have a clinical diagnosis of heart failure. And in fact,
Wow.
yeah, their baseline NT-proBNP was under 100 generally. So these are not people with fully manifested heart failure, but it just illustrates how stage B heart failure may be far less than asymptomatic. In fact, it's just that it's just not recognized at this stage. 50% of the study participants, there were nearly 700, 50% were women. So we were literally 50-50 male
Wow.
male.
Congratulations.
Thank you. We definitely worked, to make sure that that happened. It was a global trial with good representation. Two-thirds were from the United States, but we had a large percentage from outside of the US. And from a baseline peak VO2 of 15.7, we randomized patients to receive placebo or two different doses of AT001. What we found was at the end of a 15-month treatment period, the peak VO2 worsened in placebo patients significantly. It did not change significantly in the patient population treated with high dose AT001. However, the difference at 15 months was not statistically significantly different. So we saw stabilization in those treated, worsening in those on placebo, but at the end of the 15 months, the difference was not large enough to achieve nominal statistical significance. What's interesting is that among the pre-specified subgroups in this population of patients, we actually pre-specified and stratified for the use of SGLT2 inhibitors and GLP-1 receptor agonists at baseline. And what we found was that among those individuals not receiving an SGLT2 or GLP-1, the difference in peak VO2 was actually quite large and quite statistically significant among those patients treated with AT001. So I wouldn't say the story is over at this point. There's definitely some reason to sort of think that there's something more to be said about this drug for treating diabetic cardiomyopathy. And indeed, in pre-specified analyses, we also showed that clinical events were reduced. There weren't many, 24 in the placebo arm and 10 and 11 in the AT001 arms, but that was statistically significantly lower as well, really arguing in favor for larger, longer studies looking at this drug in patients with heart muscle disease from diabetes.
Fascinating. I think the population in general, doctors in general, even some cardiologists in general, think of heart failure as just a flabby, broken muscle. They think of it mechanically, but it's a metabolic disease too, I think, is what we're learning. And it's fascinating to hear about how drugs like this may improve metabolism and minimize heart failure that may not be all that clinically manifest. Congratulations, Jim. I look forward to the next steps. Hope you get to test this out in larger numbers of people and see what you find.
Yeah, we're really hopeful that this is a next step into the whole cardiometabolic world that we're all really enthusiastic about. And we're excited about the results. Could have turned out a little differently, but still, I think there's a path forwards. And the results are going to be published, or have been published actually now, in the Journal of the American College of Cardiology.
Congratulations. You and I are becoming diabetocardiologists now, or cardiodiabetologists, both are
Absolutely. And,
those are
more than half of our patients have it. So
yeah.
we might as well get on board.
And if you don't have it, you may get it. So
Right.
I'm trying to ward it off myself. Jim, thanks so much. Thanks for joining us. And thanks to all of you for joining us here live from ACC 2024.